start with another handout. All right, there you go. There you go. Oops, I don't want to get these two away. Well, we got the name right. So I'm the chair of the Corvallis Homeless Shelter Coalition, which is a different 501c3 than the one I spoke about earlier. And basically what I would like to do is, again, go down the suggested briefing guide and tell you a little bit about what we do for the community. So as a Homeless Shelter Coalition, our primary purpose is to provide services to individuals and groups that are within its designated service area, the Benton County area. And we basically have, in the past, for the last 5 years, provided a men's cold weather shelter to men who are chronically homeless. And the shelter operates from like November 15th through March 15th. So it's still yucky out there, and I feel really guilty each night when it's raining and I go to bed and I know that they aren't in safe spaces. We have beds for 42 men, and we operate that shelter from 7 at night to 7 in the morning, and the buses take them back and forth to town. We provide food, water, shelter, showers, toilets, warmth, blankets, sleeping bags, etc. And we also facilitate access to medical care and preventive health services, and that's what I want to talk about here today. The Homeless Shelter Coalition actually reduces the dependency on emergency room visits and on incarceration, actually, by some of the things that we are able to do through the services that we provide. In addition to the Homeless Shelter Coalition having the overnight shelter, we're embarking on a huge project that's a Housing First project. It's called Partners Place, and most of you have probably heard about it or given money already, because Barbara Ross is really good at asking for money. And it takes a lot of money to run something like this. It's going to be permanent supportive housing for about 14 chronically homeless people. And the residence is projected to be ready by July or August. Anyway, what we're trying to do with the project that I'm asking for money this evening is to ensure that we can do the medical piece. We had last year asked for money, and we received $5,000, $2,500 from United Way, and then another special grant that brought it up to what we had asked for. And basically what the money is going to do is to provide basic visits, basic visit fee of about $20 to the Benton County Health Department, to their clinics across the healthcare services for either guests at the men's shelter or now Partners Place. But in addition, we collaborate very closely on a cooperation level with the daytime drop-in center that I talked about before. So it's not going to be just helping out the folks that are at the shelter or at Partners Place, but we also help out like women and children that come into our vision field. And so basically, we're asking for $7,000 this year because we know that this demand is getting bigger and bigger as we've been gaining more trust. People know of us now, and I'll tell you in a little bit about how many people we've served. Okay, some of the things that we do, basically, the specific things, as I mentioned, are the $20 visit, but prescription costs are very high, and so that's a variable that we never know about. We try to do everything we can, but if somebody's prescription is over $40, then it gets a little bit tricky, and so we try to say, well, we can pay half or we can pay as much as we can, and a lot of it will depend on what month. I try to budget each month so that we have enough for the whole year. Some medical procedures cannot be performed by the Benton County Health Department, and depending on other providers' cooperation, these things aren't going to happen, but sometimes we do that kind of networking and try to figure out ways to do such things. So basically, 1 unit of service would be the visit and the resulting prescription costs. That can range between $5 and $75, sometimes even more if we have the funds. How many additional people would this help? Well, last year when we had $5,000, we helped a lot of folks, and we spent from July to January about $2,000 and a little over $2,000, and we anticipate that through June we'll probably spend the rest. But I wanted to say that this probably says a lot about what we do. This is a part of the report we gave to United Way halfway through, and it was about one person. It says, Donna's medical home was not stable. She self-medicated with prescribed drugs from the hospital and supplemented by street drugs. Her situation is chronic anxiety, among a plethora of other significant diagnoses. By having a financial source to pursue a stable medical home with the Benton County Health Department, Donna hoped to establish a stable relationship with a doctor that would come to know her situation and be able to regulate her medication's effectiveness. So a doctor was assigned to her, and she's now able to give feedback to the same person wherever she is needed, and the doctor can closely follow her situation, make adjustments immediately to help her quest for stability. So she's receiving timely and quality medical and mental health services. In addition, the documentation of the doctor helped Donna to receive presumptive medical benefits, so she's now on the Oregon Health Plan. So all the things that we do really do save the community on trips to the emergency room, et cetera, et cetera. So the likelihood of success is very high. Every person we help is, may seem like a drop in the bucket, but to that person it's really, really helpful. And it helps save a lot of other emergency room visits, et cetera. If we got 50%, what would we do? Well, again, we would attempt to do the best we could with what we have, but also we work to obtain funding from other service agencies in the community. So that's, we're going to try to do it because we know the need is great and there isn't a whole lot of other folks around that are doing this service. Question?
What pharmacy do you use to purchase medication?
Well, the Benton County Health Department has a relationship with Safeway down here, but we use all the others that they get prescriptions from, because it's not always that they go to Benton County Health Department. We get a lot of things with Good Samaritan, and Good Samaritan's been really, really great with a collaboration of helping us through a scabies epidemic, and that's another partnership we're working on with another grant with the Health Department in collaboration with Good Samaritan. So we use all of those that are available.
So when you call a pharmacy, would someone is getting a prescription from Safeway, for example, then you would go back and see what Safeway would charge that for retail price?
Usually the health department sends the prescriptions, and then we are told they're there, and we go and we just pay. We don't let the person go by themselves. We get the medication for them. So I'm not sure that answers your question.
No. How do you know if you're paying the right price?
We trust the Benton County Health Department's gotten the best deal they can. And
okay. They'll negotiate the price.
They do. They do a great job. I mean, I've had to get medicine from some others that they haven't had deals with. It's way different. But also Fred Meyer does collaborate with the health department, and
okay.
they give very good deals as well. So we're getting the best we can. Yes, go ahead.
I know this question came up before in another context, but can you explain to me how your services are different from community outreach's medical services?
We also refer people to go there as well. They have, their clinic is staffed, if my understanding is correct, by volunteers from Good Samaritan, and the Benton County Health Department and Good Sam work together too. But pretty much there's some people who aren't able to go there, and some people just ending up in the emergency room. So we try to catch them before that happens and get them to a medical home. And it's also true that, if you go to the COI's clinic, there's 3 a week. There's a morning, really you have to get up like at 6:30, get in line, not quite that early, but you have to get there, and they only see like 10 people a day. You have to go Monday morning or Friday morning, and Wednesdays in the evening, pretty much saved for folks who are working. So it's not as accessible if you have an emergency on Thursday. So I don't know if that answers your question.
I'm going to ask everybody to write down your questions, please.
Yeah, sorry.
Thank you very much.